How do you make the diagnosis again?
So the main way we make the diagnosis is when we use what's called a slit lamp examination. So the slit lamp is, you might remember, anytime you go to the eye doctor, they have you put your chin on that little thing, and that little band across your forehead. And when the eye doctor is looking in there, they're using a beam of light that's a slit off to the side, and we can see three-dimensionally depth into the eye, and we actually see the lens that's gotten cloudy. So we actually get to see the pathology. And then also at that time, we'll look back at the retina and at the front of the cornea to make sure there's other pathology that wouldn't be interfering with the eye or might limit how much vision we might get back when we do cataract surgery.
In medical school, when I got to look at a slit lamp one time, I thought it was the most exciting, most wonderful, most magnificent thing I had ever seen. So you can see the lens, you can tell if it's getting cloudy. So if you and the patient decide on you have to have cataract surgery, how's it done?
Usually cataract surgery is done as an outpatient at like an outpatient surgery center. And mind you, this is one of my very favorite things to do and one of my favorite things to talk about, because the surgery only takes about 10 minutes, and in 10 minutes, you can change your life. You can change someone's life in 10 minutes.
So you don't have to go to the hospital, you don't have to have general anesthesia, you don't have to do all that. It can be done in the office.
So yeah, in an office setting, in a surgery center, we usually do have an IV put in for some light sedation, like if you were going to have a colonoscopy or something like that. So a little light conscious sedation is usually on board. We make a very small incision. When I'm doing the cataract surgery, my incision size is only 2.4 millimeters.
So that's like pinpoint.
It is about the size of a pinpoint. So because of that, there's no stitches required, so there's no sutures, and it's a very fast recovery.
So you make a little 2.5 millimeter incision. So how do you get the cataract out? You reach in there and pull it out? What do you do?
So what we have to do, because of the small incision size, we use something called phacoemulsification. It's
phacoemulsification. What is that?
So basically it's ultrasound that breaks that cataract up into small little bits, and then we suck it out in small little bits.
So you remove it that way out of a little, and now you got to put something back in there.
Yes. So one of the great things that the lens implants we have now are foldable plastic. So they are plastic, usually an acrylic, either acrylic or silicone. And you can fold them up in a little cartridge and then slip them through that tiny little incision and unfold it inside the eye.
And so it goes whoop, and it's out there inside the eye. And is that better than the old lens, or perfect? What is it?
They're much better. Well, because anytime you can make a smaller incision, it's going to be an easier recovery and an easier experience for the patient.